Good afternoon, everyone, and welcome to the American Lung Association's COVID-19 Mental Health, Spatial Distancing, Not Social Distancing Town Hall. Before we begin, as a reminder, at the bottom of your screen, there will be multiple application widgets that you can use throughout today's program. All of the boxes are resizable and movable, so feel free to get the most out of your desktop space. For best viewing experience, we recommend using a wired internet connection and closing any programs or browser sessions running in your background. For the best audio quality, please make sure that your computer speakers or your headsets are turned on and the volume is up so you can hear the presenters. And make sure the media player on your screen is enabled. If you have any technical difficulties during the town hall, please let us know via the Q&A box. If you also have any questions during the town hall, you can submit them through the Q&A box on your screen. The webcast is being recorded today and will be available tomorrow and can be accessed using the same link that you used to register. And now we will begin the webcast, and I'd love to turn it over to Dr. Al Rizzo, the Chief Medical Officer for the American Lung Association. Dr. Rizzo?
Thank you, Annette, and thank you all for joining us today. Public health emergencies like the COVID-19 pandemic may affect the health, safety, and well-being of both individuals and communities. These effects may translate into a range of emotional reactions, unhealthy behaviors, and non-compliance with public health directives. Today, our panelists are going to provide strategies and tools on what to look for and how to help your loved ones, co-workers, and yourself during the pandemic to maintain good physical and mental health as we navigate this new normal together. How people can remain together even while being apart. At this time, I'd like to introduce today's panelists and allow each panelist to give a brief statement regarding their professional background and experience. We will start with Dr. Tayesh Hall. Dr. Tayesh Hall Brown, Associate Professor in the Department of Psychiatry and Behavioral Sciences at Howard University College of Medicine. Dr. Hall Brown. Dr. Brown, I don't know if we can hear you.
Thank you. Can you hear me now?
Yes.
Hello?
Yes.
Okay, great. Thank you again for having me. To tell you a little bit about myself, I'm a clinical psychologist by training and currently the director of the Howard University School-Based Behavioral Health Program. Broadly, my research focuses on the relationship between sleep and stress in teens. However, clinically, my focus is on increasing early identification of mental health conditions in youth and increasing access to care. Most recently, our program has strived to find creative ways to connect with youth and their families during the COVID pandemic, including creating an Instagram page to extend our reach into the community.
Thank you. Next, have Dr. Ken Duckworth, Medical Director, National Alliance on Mental Illness. Dr. Duckworth.
Thank you, Dr. Rizzo. It's a pleasure to be here. NAMI, the National Alliance on Mental Illness, is the largest grassroots organization of people living with mental health conditions and those who love them. And we do a lot of education, support, and advocacy. I happen to be a child and adolescent psychiatrist, and I'm delighted to be part of this discussion.
Thank you. And then we have JoJo O'Neill, who's an on-air radio personality in Florida since 1985, and also the founder and president of Let's Kick Asthma Foundation. JoJo? JoJo, I don't think we can hear you.
Now I'm there. How's that?
Very good.
Okay.
Very good.
Okay. So I again thank you for allowing me to be a part of this town hall today. You mentioned it. You said it. I'm a radio personality since the mid-'80s, based out of Orlando my entire career, with no medical history prior to 2004, no health issues in 2004, diagnosed with asthma, and then over the years just asked questions, met different specialists and doctors, and that kind of led me to, first of all, finding out about my own condition, but then reaching out to others and forming an organization. It's a 501c3 nonprofit, the Let's Kick Asthma Foundation, and we offer support to those who are battling asthma And if they have their symptoms under control, we invite them to join us so that they can share that success with others as well. But we offer emotional, educational, financial support for asthma patients and connected to the American Lung Association as well. So thank you again for having me here.
Thank you, JoJo. How you respond to stress during the COVID-19 pandemic can depend on your background, your social support from family or friends, your financial situation, your health, emotional background, the community you live in, and many other factors. The changes that can happen because of the COVID-19 pandemic and the ways we try to contain the spread of the virus can affect anyone. Today, we're going to discuss a societal and multi-generational approach with our panelists. Fear and anxiety about COVID-19 and what could happen can be overwhelming and cause strong emotions. Public health actions such as social distancing can make people feel isolated, lonely, and can increase stress and anxiety. Dr. Hall-Brown, to kick us off, let's talk about children and teenagers. What sort of feelings are they experiencing during this prolonged period of spatial distancing?
Yeah, I think the uncertainty has really brought along a lot of different emotions, and those emotions can occur on any day. So it's not just one emotion today, another tomorrow. It's almost like a roller coaster, and it spans from anxiety, depression, irritability, being overwhelmed by circumstances. But you also have happy and content for some. Some are feeling disconnected or angry. So I think there's a wide range of emotions that are going on right now.
Thank you. Dr. Duckworth, could you open with discussing the challenges adults are facing, either as parents or childless individuals? And then will you follow up by discussing the unique needs older adults may experience during the pandemic?
Sure. Obviously, our brains are wired to detect uncertainty and threat. And so people who report an increased sense of anxiety, the new onset of panic, sleep disturbance, an increased sense of anxiety overall, not tied to anything, are basically within a normal bell curve. It's also really important to remember that 1 in 5 Americans had a diagnosed mental health condition before the pandemic. And one of the things at NAMI that we've been interested in, making sure those people get the care that they need. We've done a lot of advocacy about making sure people have access to telehealth, a video connection just like this with a licensed mental health practitioner, and also access to phone sessions. Some people don't have the internet. We have a big internet divide in our country. Some people don't have privacy in their home. So we've been advocating for health plans, Medicare and Medicaids to cover phone sessions as well. NAMI support groups are ongoing, online, and I do think it's important because I think connection is one vehicle to reduce anxiety. You are not alone is one of our mantras at NAMI, and I think you can create that by being part of a community. NAMI is one such community, although there are many others.
Great advice. Thank you. Mm-hmm. JoJo, having asthma yourself, you represent a patient group that many consider at high risk for severe complications from COVID-19. How does that play on your emotions and modify your behavior?
Oh my goodness, it gets inside your head, and there are times when that's all you can think about is, wait a minute, how am I breathing? Am I breathing okay? What's going on? Is my chest getting heavy? Is that a sniffle, or what's going? It really does get inside your head. And so with our Let's Kick Asthma support groups, we've actually, each month we do offer information from experts. And so we have different topics, and we have had a psychologist on as one of our guests. We've had a therapist on as one of our guests, so that we can figure out how to get through each day. Because like one of the doctors mentioned earlier, your emotions are on a roller coaster. Sometimes you're happy and content, other times you're panicked and fearful, especially having the realization that we already know what it feels like to struggle to breathe, and it's very scary. And so we're coming from that angle as well. And so, yeah, having different resources that we can reach out to is very helpful.
Thank you. Dr. Hall-Brown, you just shared some emotional challenges youth may be experiencing. Can you share some strategies we can put into place to reduce the strain of these feelings?
Absolutely. I think that first and foremost, parents and other family members should check in with their youth. Sometimes youth don't feel comfortable coming to us, but if we can establish a consistent check-in with them, that'll allow us to kind of gauge where they are in terms of, what feeling they may be having at that moment or across a week. So I'd say checking in. Secondly, normalizing their behavior. As was stated earlier, some of these feelings are absolutely within the range of normal. We're all kind of on a roller coaster ourselves, but it doesn't make it any easier to deal with at times. So just because someone's anxious, we want to make sure that they know that that's not something that's pathological necessarily. It could be just a feeling they're having right now, but it's not a feeling that will last forever. Other people are having that feeling, and provide them with support. I'd say also reframing their negative thoughts. So I know I have a teen at home as well, and sometimes we'll hear, we'll never get back to school, we'll never see our friends again. Everything's kind of a catastrophic thought. But if we can actually pinpoint and get to the root of what that worry is, it makes it a little bit easier to handle. So instead of, I'll never see my friends again, it's more of, okay, I'm not able to see my friends at this moment, but perhaps there's some other things that I can do. And then I'd say also help them build a toolbox of coping strategies. I think we all think it comes naturally to cope with different things, but it doesn't for some. And so teaching them strategies such as centering strategies or mindfulness or something as simple as journaling or listening to music to de-stress, that'll help them as well, particularly when they're feeling overwhelmed, on a certain day.
Thank you. Dr. Duckworth, as the Chief Medical Officer of the nation's largest grassroots mental health organization, can you highlight a few more of the resources available and what adults can do to help address the fear and worry about their own health, the health of their loved ones, their financial situation or jobs, or even the loss of support services? They rely not only on to survive, but to thrive.
One of the silver linings to the pandemic is that we've hit a tipping point in our society on people talking about their mental health and reaching out for support. NAMI runs a support line. It is not a suicide lifeline. It is staffed by dozens of people who've lived with a mental health vulnerability or love someone who has and provide troubleshooting. Our business is booming as people are searching for ways to cope, places to find resources. We have a COVID-19 guide in English and in Spanish on our website that has, I think, 500,000 downloads last time I checked, looking at places to go, anticipating problems that people might have. For people who are dealing with economic, financial insecurity, that's not a main thrust of NAMI. We support people who live with mental health conditions, but I would encourage you, if you have a job and are worried you're going to lose it, frequently employee assistance plans help people with financial anxiety and distress, and you typically get 3 or 2 sessions for free with somebody just to troubleshoot. Again, back to the other doctor's perspective, your ability to plan and anticipate can be a way to manage anxiety so it doesn't generate its own momentum.
Thank you. We are getting questions coming in from the audience, and we appreciate that. I have a few more I want to put out to our panelists first. Jojo, taking care of your friends and your family can be seen as a stress reliever, but it should be balanced with care for yourself. Helping others cope with their stress, such as by providing social support, can also make your community stronger. You are a very engaged and active member of your community as a radio personality and running a nonprofit for individuals with asthma. What are some things that you have shared about how to cope with feeling lonely or anxious, and how can friends and family stay connected?
Well, that's a very good question. This whole pandemic has caused us to really just research our creativity and take it to a whole new level and find creative ways to interact with one another. I know that I do reach out to other people sometimes and it makes me feel better. But at the same time, I also know that I need to reach out sometimes just for support myself. And so I make sure that I'm aware of that and that I do reach out with my family and with members of our Let's Kick Asthma organization. We were exploring the new technology for us. You know, it's new technology with the Zoom app and the GoToMeeting and what we're doing here on this platform with Teams, with Microsoft. We explore the video apps and the chats. I even went over to one of my sister's houses in person, but I sat on her back patio and had her sit inside and chat with me through the screen door, of course, with all of us wearing masks, you know. So we're having to be very creative, and I think it's important because, and I like the way we're saying spatial distancing and not social distancing, because we do need social interaction as human beings. That's who we are, and that's what makes most of us tick. And so to be able to interact with one another and find creative ways to do it, I think is good. I think we're going to come out for the better on the other side of all of this. We can also explore new hobbies, things that we might have been interested in that we didn't have time for before is a nice distraction, you know, cooking or walking or bike riding, things like that can really help us come out on the other side of this pandemic as better off overall.
Thank you. Dr. Hall-Brown, we continue to see rising numbers of COVID-19 infections in our younger populations. And as we're having this national debate about back to school, remote, on site, why do you think that is? And how do I keep my children and young adults motivated to maintain spatial distancing during the pandemic?
Yeah, so I'm gonna try to answer them one at a time. For your first question, I don't think there's one causal factor for this increase. The data suggests that there are multiple factors, including an emphasis or stronger emphasis on testing youth, more involvement in summer activities and camps and people out and about. Some have a higher risk tolerance, and then family attitudes all could play a role in this increase that we're seeing. And for the second part of your question, what do we do? Some of this is similar to what we would do in any situation with our kids, but in particular, discuss the facts. Let them know kind of what this pandemic means, what things they need to take into consideration, how they can keep themselves safe, how they can keep their community safe. Having knowledge is a really powerful tool for them. It'll decrease the anxiety, but it'll also help them to understand why these other restrictions or guidelines are being put in place. And we know they're fluid, so on a daily basis, things may change. So keeping up with that and helping them to understand what these changes mean and why one news outlet may say one thing and another may say another, helping them to kind of process that information is really important. And then modeling good behavior. Sometimes as adults, we say one thing, but we do maybe another thing. So in this instance, if we can try to model good behavior, I think that goes a long way as well. So they see you doing something. So for instance, if we tell our kids that they can't get together with their friends, but then we may go out and meet up with some friends, that sends a mixed message and also causes some, kind of mental strife, so to speak, because they're seeing one thing and hearing another. But if we can model the same behaviors that we're asking of them, then that will be helpful. Providing a list of activities. Sometimes we think, oh, you have tons of things to do in a house. There's tons of things that you can do. But in the moment, you don't think about that. So if you can have a list and kind of check them off or give them ideas of what they can do when they're feeling, like there's nothing to do or they're bored, that will also be helpful in terms of helping them to keep with these guidelines. And then finally, I'd say discuss their frustrations. It is okay to be frustrated with all this. I think at times we're all fed up. I don't know if any of you have seen some of the things that are going around on Instagram with the 9 blocks where like in January, everybody's kind of happy and go lucky and carefree. And then by the time you get to April, people are starting to get upset and people are tearful. And then by the time you get to August and September, people are either in warrior mode or they're just beat down. So we all have had a range of emotions, as we discussed earlier, but frustration in particular is one that I think teens and children experience, and we just want to try to find a way to help them with that. Normalize it. It's okay to feel frustrated, but what can we do? What active steps can we do to help you overcome this?
Great advice. Dr. Duckworth, people always say, if I just had more time, I could be more productive. But during the pandemic, many people have lots of time and yet find themselves not always wanting to exercise, cook healthy meals, or take up a hobby. How does one stay motivated and keep their family motivated during COVID-19?
That's a good question. And I think that structure helps people, right? So you exercise before you work. You construct 3 hours of work, then you take a walk with the people in your family bubble, as it were. And kids, of course, rely a lot on structure. So I encourage parents, for example, to put up a structure. It's going to look really simple. This is school-age kids. Breakfast, 2 hours of schoolwork, 1 hour of television, PlayStation, lunch, right? Like, there's a structure. It's not just, the unknowable freewheeling life, which I'm not against if your child can respond to that. Many people do better with structure. And I think that imposing a routine or a structure upon yourself. So at 5 o'clock today, I know this doesn't seem like I'm in a work outfit, but this is about as dressed up as I've gotten at month 6. I'll put on a T-shirt, change my outfit, and I'll be in play mode, even though I will be in the same physical space, right? So the idea is I'm working now, even though it's a pleasure to chat with all three of you and to be part of this conversation. This is at least theoretically part of my work structure. And at 5 o'clock, I'm going to hang it up, put on my favorite college T-shirt, reflect on the fact that college football has been canceled because we have, been unable to manage this as a society, as another source of frustration, as my colleagues have identified.
Great, thank you. Jojo, you may have touched on this, but you and your family have sheltered in place. And what have you found to be a helpful strategy? And what advice can you give to the listening audience and members of your asthma coalition about what to do during this time?
I think, and actually going back to what Dr. Duckworth just said, that structure really is helpful. It has taken me maybe about 3 months to try and get into a routine and try and make every part of my house feel like a different part of my life. Like where I am right now, I'm working. This is my office. My gym is right over there where the treadmill is, and the kitchen is the kitchen. So it took some time to get all that down, but just being able to map out your day and decide, okay, well, this is what I'm going to do at this time of day, and then I'll do something else, and just figuring it out. It's one thing that I really suggest, and I suggested this to our Let's Kick Asthma family as well. Take time to unplug. There is information overload right now, and not all of it is credible. So I tell people, you gotta back away from it. You can't constantly focus on everything that's going on in the country and in the world. You gotta take some time to just decompress. It's information overload, and it can end up being detrimental to your mental health overall. Turn off the news sometimes. And then when you are plugged in, to just get the information that you need to know, get it from credible sources. Because I tell you, there's a lot out there, and I see some things that are, whether it's on the internet in some form or on websites that are not from credible sources. There's a lot that can just filter in and really throw your mind off. And of course, once your mind is thrown off, everything else in your life begins to crumble. And so that's basically, I think, the one thing I would say is unplug.
Dr. Rizzo, may I add a comment?
Yeah, absolutely.
I used to treat the media like strong coffee, which means I stopped consuming media by noon. And then I realized that actually was insufficient. So I do the full hour in the morning, got your Kamala Harris, got your economic catastrophe, got your Russian vaccine. Okay, wear a mask. Gators aren't as good as a mask. I learned that today. Great. I'm done by 8 a.m. because I find, this is just, again, just a mental health perspective, anxiety provocation is real. And if you have a vulnerability towards anxiety, or you love someone, who has a medical vulnerability, they're part of a disenfranchised class, or they have hypertension, asthma, diabetes, right? You have to worry about these things. So the idea is, I love this idea that you get the information you need and then you stop. And it's a self-learning process. I used to, watch the media in the middle of the day. I had to stop that because I found it was still resonating with my anxiety. After dinner, forget about it, right? I'm Netflix or take a walk all the way. But that's just what I've learned about my own self-regulation. But I did like what you said about that.
And I would third that. I do the same thing. I do a half an hour in the morning, and that's it. You give an hour. I do a half an hour, but I'll do it on Instagram, but I also do it on the news outlets, and then I'm done, because I completely agree with you. And particularly for children who are listening to it right before bedtime, or who we may have it on and we don't think they're listening, but they really do hear it, that could definitely increase their anxiety levels and make it difficult for them to fall asleep.
So if we're listening to less media during the day, we have more time to listen to webinars like this and town halls. So that's good. This kind of feeds into my next question a little bit. We recognize that the COVID pandemic has unleashed emotions throughout the country, and young and old alike. Dr. Hall-Brown, as a licensed clinical psychologist, when should individuals or parents of children reach out to their healthcare provider with concerns about their emotional health? And how do you recommend they start that conversation if emotional health hasn't been part of their past?
Great question. So, for my patients, I have kind of a mnemonic device that I use, or when I'm doing prevention work and just letting people know what to look for. So it's as simple as BASE. So if you look for drastic changes in their BASE levels that may impact their daily function. The B in BASE is their behavior. So are they becoming reclusive or have loss of interest? Are they hypervigilant toward their health? Uncontrollable kind of mood swings, or are they unfocused? But these are things that are changes from their base level. Changes in appetite for A, eating more, eating less than usual. Are they constantly snacking? S is for sleep, sleeping more or less than usual, having shifted schedules, lots of daytime sleepiness, or insomnia or nightmares at night. And finally, the E in BASE is emotions. So poor emotion regulation. Are they really irritable? Are they having mood swings, or easily frustrated? So I think if you're seeing any drastic changes in those areas, that's a really good time to connect with your primary care provider, or even a mental health professional, and discuss whether or not they believe your child needs additional services, or if they believe that they may need more professional help. And then the second part of your question, I think, how do you start the conversation? Starting the conversation, again, is really just giving the details. So when you go to the doctor's office, they're asking you to tell them what's going on with your child, how are things? And sometimes we neglect to tell them how they're doing mentally. I think if you just start talking about, so-and-so's been a little bit irritable lately, and then that'll help them to start asking you more questions about why they think that irritability has increased, or, their appetite, they're not eating as much as usual. Just make note of things that you think are changes that you would want to talk with your doctor about, and then, easily kind of tell them these are the things that I'm noticing in my child. Usually the doctor will ask some of those questions, but if they're not, you can tell them what you're noticing in terms of the differences, and keep a journal of it if you really feel like it's something that's pervasive. So on Monday, my child may have been really low mood and tearful, but on Wednesday they were, fine, and there wasn't a problem. But Thursday they may have been throwing tantrums or a little uncontrollable with their behavior. So if you keep a little journal, if you know you're about to go, or if you feel like you need to have an appointment with the doctor, keeping that journal will give them exact dates and times, and will help them also place perhaps what are some of the antecedents to that behavior, and or how they might be able to kind of pull that information together to determine whether or not there's a mental health problem.
Great. Dr. Duckworth, the toll of the pandemic is affecting everyone, and a certain group, particularly the healthcare providers, is one we're concerned about. What can you share with the group regarding emotional health of our doctors, nurses, respiratory therapists, and is there a way that we can support this group, who may also be our friends, family, and neighbors?
Well, I think a couple strategies that I've seen hospitals use is reducing dose of, exposure to trauma. So if people are on the front lines, are there nurses who are working in the outpatient or on the floor who can work in the intensive care unit? Because I think one of the things we know about post-traumatic stress is exposure to the stress is an important piece of the risk of development of PTSD. The other is access to support. So within the culture that you're in, are you allowed to have this experience or feeling, right? That's important. And is it okay to be distressed? And also accessing teletherapy through video conference calls can be very helpful. Mental health practitioners are ready.
Thank you. Jojo, you live in an area right now where there seem to be alarming increases in case rates of COVID-19. What do you feel is missing or misleading in the discussion about the coronavirus pandemic that might help turn the tide in your community or your state?
It's interesting because just seeing different comments on social media, people are somewhat polarized. There's some who have no idea why they're being asked to wear masks. They think it's to protect themselves. And then there are others who totally get it and they realize, okay, we're being asked to do this so that we can protect basically those around us to stop the spread. I think, and this is just my personal opinion, that we have a lot of people who just don't like being told what to do, so they rebel against being told what to do. But I think just more information out there of how important it is to the general health of the entire population to comply with what's being asked of us by the medical community and the healthcare professionals, by the CDC and the World Health Organization, just to make it better for everyone. Sometimes I feel that the people who are non-compliant, and in our area, like you mentioned, we're a hot spot here in Orlando, Florida in particular, but the state of Florida, I think a lot of people they have not been personally touched by this virus or this disease. And so that can sometimes lead to them being non-compliant and not wanting to abide by, what's best, what's being asked of us. But that's just my personal opinion on that.
Right.
But I'm seeing that there are more and more people, because the business community is getting involved with our stores and our large chains, and our stores are requiring masks to be worn inside their stores. So that's helping, some of the restaurants as well. No shirt, no shoes, no mask, no service, so that is helping too.
Thank you. And if I could remind people who are not speaking to go on mute, we have a little bit of background noise occurring. One question I'd like to throw out to the three of you. Earlier was mentioned about connections, and Dr. Duckworth mentioned the technology divide. Talk a little bit more about the fact that technology plays a huge role in connecting. What about the people who have limited or no access to such tools? How can we reach out to them?
Well, I would say this is the time when we get creative and also think back to what we did before internet and before all of this online access. I've encouraged people to write letters to their family to stay connected. Letters and postcards are kind of a lost art. No one really does that anymore, but it's fun to receive them. And it's a really good way for children and adolescents to kind of connect with their family members. Phone calls, not texting necessarily or FaceTime, but perhaps just a phone call that's just audio based, or sending pictures, hard copies of pictures. Again, everything's usually on our phone. We have everything kind of online or, kind of internet ready, but we can still get hard copies of pictures and things. So I think there's definitely ways to connect and play board games, do different things that we used to do in the past, but have maybe gotten away from a little bit.
Great advice. So we do have some questions that come in from the audience. I'd like to throw a few out to you. One question is, how do you recommend responding to people who state that everyone they know who's had COVID said it's not a big deal?
If I may, I've had conversations with those who are on the front lines of it, and I've seen people, healthcare providers, nurses, they have posted videos on social media of what the experience is really like for those who it has hit harder and those whose lives have been lost. I think hearing those stories will help to bring that home, that just because it doesn't affect one person, they have mild symptoms, the next person it may not be the same way. So just hearing the stories from the front lines really has helped me. It caused me to be a lot more compassionate and sympathetic.
This does require some sophistication, that many people have no symptoms, that this virus can be transmitted when people don't experience anything, that it is catastrophic for some people, that it can lead to lifelong lung damage. For the American Lung Association of interest, cardiovascular damage. I'm a baseball fan. There's a pitcher from the Boston Red Sox who had to stop his season because of myocarditis that he did not have before getting COVID. So there are many truths here, and I think it requires some thought to say it is possible to get COVID and to be fine. I know such people. And it is possible to get COVID and have a catastrophic illness. I know such people. And I certainly know of people who have had ongoing lung or heart damage as a result. So it's very important to not draw narrow conclusions from a limited data set, right? Two of my family members got this, lost all sense of smell, weren't sick at all. They were scary people to me because I knew even in April that, other people in our lives might have different vulnerabilities. We don't understand this well. And not knowing is an important posture to take because we're in a continuous learning experience, right? We were caught flat-footed by this pandemic from a public health, medical, educational point of view. And we're continuously in a learning process. So I would encourage people not to think the way I do, but to be in an open learning framework. And it is also true that many people don't get sick. So you have to be able to really have an open mind about our continuous learning experience, right? The idea that steroids are helpful, anticoagulation is helpful. We're figuring these things out in very real time.
Right.
I agree.
No, I think you bring up a good point. I'm sorry. Go ahead. I'll go in later.
Oh, sorry. I was going to say I agree with what's being said. I think the one thing that could potentially help a teen who may be having that thought or feeling that way is to find something that's salient to them. So as we've noted, there are people who have had it and have had catastrophic kind of results with it. But if the teen doesn't know that person or can't connect or, have any connection with them, then it's almost like it doesn't happen or it hasn't happened. So if you can find someone that they kind of know or that they can connect with, that can help with that education process. And, every day there are new, people coming out talking about their experiences with it, from people who thought there was nothing going on, went to COVID parties and then came back and, ended up having it and being on a respirator or ventilator, sorry. So I think really finding someone that they can connect with or identify with is also a key for teens.
And I wanted to interject just as a challenge for the American Lung Association. Dr. Duckworth has mentioned that the last 8 months, we've seen an unprecedented amount of worldwide collaboration between physicians and researchers, and tons of medical and scientific information are being put up in these preprint servers that really have not been vetted the way publications are, but it's information that's getting out into the public, certainly to help advance the science. But unfortunately, this leads to myths, misinformation, media hype, and sometimes even politicalization of actions that are recommended for public health reasons. And as a trusted champion of lung health, the ALA needs to be, as much as possible, get information out transparently and base it on good evidence. And that is a challenge in this time of the pandemic. So all great discussion there. I wanted to move on to another question. What advice would you give to a college freshman who just moved into a dorm room? How can they possibly try to balance safety and socialization other than with mask, hand washing, and distance attempts?
I'm happy to jump in. I think it's really kind of, it's hard because they have expectations of what their college experience should be, right? So one of the things that I've told a lot of people is we have to readjust our expectations. So we may have thought of our freshman year as a time to party and hang out and do all these things that we can't do now. And now if we can just readjust that thought and think of what we can do, so focus more on what you're able to do versus what you thought you were going to do, that changes, I think, how we go about our daily interactions and our time on campus. So they can do things, they can still interact, but they have to be 6 feet apart, right? So making sure that we maintain that spatial distancing, that we're wearing our masks, that when they go to class, we can still connect. Maybe they're at a library 6 feet apart, they're on their computers, they're still studying together, but they're just not right on top of each other. There's still things that they can do, but they have to readjust their expectations so that they're not disappointed, essentially.
I think college freshmen,
another question
like a lot of people who are seniors, people who are struggling with anxiety at work. I mean, the pandemic, this has impacted everything. From going to the store to going to college, kids missing prom, right? People in medical school now faced with tremendous anxieties that they didn't anticipate 3 years ago when they simply took a very difficult exam. Now they're going to be exposed to something that could harm them or someone in their lives. College freshmen are not alone. I'm not saying it's easy. I'm not saying it's a positive. You're going to have to find a way to work creatively. I don't think this will last forever. And again, Dr. Hall-Brown mentioned the idea, I'll never get to see my friends. Try to stay away from catastrophic, automatic thinking. We might be at this for a while. I can't say a year, 2 years. I think it's unlikely your entire college experience will be ruined by this. But I'm not saying it's not going to be a great first year. It's going to be a difficult first year, right? I have several people in my family that are going to college. They're going to go to a dorm room in a foreign city and engage in classes online. The families are paying full tuition. There's not a lot of love for this reality, but this is the situation that we face. And I think it's important to actually face it. And I have another person in my life who's not going to go to high school this year. The school district has said no high school. Well, this happens to be her senior year. And the idea of being in the class play and doing prom and all those activities is likely to be shortchanged. And this is a difficult situation. And, we just have to acknowledge that, as was mentioned earlier. It's okay to be frustrated. It's okay to be upset. And let's figure out our resilience and creative approaches to this. I have a friend whose daughter is a teenager. They get together in a park and sit on the front of their cars and talk to each other. Let me acknowledge, not everybody has a car. Not everybody can do this. This is just one person that I know. Teenage girl. She's hanging out with her friends 3 nights a week. She's doing what she's supposed to be doing, which is seeing people that are her age. But they're doing it at a local park, and they stay away from each other. I mean, it's kind of brilliant.
Yep. Great advice. Here's an interesting question I'll throw out to you all. The question is it detrimental in any way to use the term, and they put it in quotes, building resiliency rather than coping with trauma and challenges? See how you answer that. I'm a little confused by the question myself.
I'm not a doctor, but I would think that building resiliency would come after coping. I think once you learn how to cope through it, that is a part of the process of building the resiliency once you come out on the other side. And like I said, I'm not a doctor or anything, but that's just my personal input on that.
You know, if you've been traumatized, if you've lost a parent, you are actually coping with trauma, right? Now, one idea that you're going to need support, services, a faith community, you're going to have to find a way through that. Is that process ultimately about resilience? It is, but coping with trauma is job one. Coping with the loss, the grief, the anxiety, the despair, right? And there are 160,000 people who died from this condition. That's a lot of people who are traumatized, who loved them, who were part of their family. And so I think it is important to recognize trauma, psychological trauma, is part of this experience for some people.
And I think what I would add to that is the idea that coping is being resilient, right? If we can cope with something, we're being resilient. So it's really, I think, in how we're thinking about resiliency. Some of it, comes after the coping. Some of it is during the coping. If you're making it through these difficult times, this difficult, challenges, you're being resilient.
I agree.
Very good. Great. This next question I'll throw to Dr. Hall-Brown. I think you touched on it earlier, but the question is, when bringing up to my child's doctor the issues of emotion, what is the best approach to addressing the mood changes without automatically getting a medication response to address it? In other words, how can I get something that's not a medication response from my healthcare provider?
Right. So the goal is when you go in that people give you a full perspective, right? We would hope that everybody gives us a full perspective, and sometimes it doesn't happen. So if you feel like when you're giving these symptoms or you're talking to your doctor about what you are seeing in your household and they're leading you towards medication and that's not the route you want to go, you can simply state to them that I do not want to give my child medication. Are there other alternatives? And the doctor will be able to give you other alternatives. Sometimes that is a go-to, and sometimes it's necessary. So there are times when medication is necessary, but there are other times when there are other paths that you can take and other routes you can take. And I think if you're not hearing or you're not getting perhaps other alternatives outside of medication, you could seek a second opinion as well. But I do think making sure that you're you are vocal in terms of what your desires or your wishes are, which is not to medicate your child, up front helps the medical professional think outside of the box with regard to what other avenues or what other referrals they can give you.
Great.
Medications are only one tool.
Mm-hmm.
They're only
Absolutely.
one tool. And I think it's very important to recognize there are many tools in a toolbox for coping with issues.
Mm-hmm.
And many mental health presentations in children and adults can be begun with behavioral strategies, cognitive behavioral strategies, activation strategies, and medications are important tools for some people and life-saving for others. But that doesn't mean that everybody needs medications.
Absolutely.
Great. Good advice. A couple more questions before we have to close. This question is, I have found myself getting angry, irritable, and anxious when I encounter community members who refuse to follow the public health orders issued by local governments. What recommendations or coping skills do you recommend for me?
I'm not sure there's a good mental health answer for this. I'm going with Zen acceptance. that you are unlikely to be able to change their political position. This is likely to be a person who has taken a political posture on a public health medical problem. I don't engage with those people, but I do avoid them because people who don't wear masks are actually riskier than people who do. And so I'm both into the zen that I can't change their perspective, and I do act by staying away from them. So that's probably part of their intent, and it's successful as a strategy for them. Obviously, if they're trying to go into a business, a restaurant, places that mandate masks, they are going to run into feedback from society, but I don't attempt to engage with them.
Right.
That's me. That's my perspective. I'm the same guy who gave up on the media after 9 a.m., though. Right? Just trying to do my work, support other people, pick my battles, right?
So I guess what I would add to that is that we definitely all have different levels of risk tolerance. That's what I call it. Even when we're talking to our friends' parents or, the parents of our children, children's friends, I should say. And we're all at different levels of that risk tolerance, right? And even though we know there's certain things that people should be doing, there's so many different reasons why people are not following the guidelines. And so I completely agree. If you feel like you're in an area where you're uncomfortable, you don't have to be there. You can always take yourself out of that situation. If you feel like you're around someone that's doing something that's unsafe, again, you can remove yourself. You have control over that. Sometimes a conversation, if it's a long-term friend, can help. But usually people are pretty stubborn at this point about why they're doing something and why they're not doing something because of all the data that are out there. And so it actually adds more stress to you because you're trying to change the world around you versus thinking about, okay, how can I, take control over what I can do to preserve my sanity and to decrease the frustration that I'm feeling.
I think that's awesome. And then I would also say, I have vent partners. Okay. So maybe create a list of vent partners, people who think the same way you think and feel the same way you feel about the situation. And when you get to a point where you're really frustrated with it, call one of your vent partners. They'll be happy to listen. And sometimes just getting it off your chest really can help. But also, like Dr. Hall Brown said, removing yourself from that situation and making sure that you are as safe as you can possibly be and taking those steps. That's definitely good, but get those vent partners on the line. They will listen because they feel the same way you do. I have a list, and I'm like, I'm calling my friend. You know what happened today? And they'll be like, what, really?
I'm going to try to get two more questions answered here before we close. One, I'm going to throw back to JoJo. It says, I was just diagnosed with asthma at age 71. I'm finding myself very anxious when I have an attack. I still want to be with my friends, but at a distance. How can I deal with this?
Definitely keep your distance. Do what you can to protect yourself. Like Dr. Hall Brown said, you have to handle what you can control, and that is your actions and who you are around. So definitely keep your distance. Refer to some of the suggestions that were made earlier in our town hall about ways to spatially distance but still be social and interact with people. And definitely stay in contact with your healthcare provider, with your doctor. And if this is a fairly new diagnosis, then your work is really beginning now as to what type of asthma it is, because you can go a lot deeper with finding out more about your condition and more about the ways to treat it specifically, get some targeted therapy for specifically the type of asthma that you have. And then I would also suggest that you connect with us, the Let's Kick Asthma Foundation, because we support one another in every way that we can. We ask questions of qualified healthcare professionals but also other professionals. We approach this from every angle we can think of, from a nutritional standpoint, from a pharmaceutical standpoint, from a health and fitness standpoint, so that we can live and breathe better and not allow asthma to control us. And so we welcome you in this group of people who understand what it's like to struggle to breathe, and getting a handle on things and learning how to manage those symptoms and be in control of the symptoms. And so we actually meet every third Thursday. Our meeting this month is next Thursday, August 20th. And if you go to our Facebook page or our Instagram page, Let's Kick Asthma, I'll have a Zoom link out there where you can click and join in and share your story and learn from others as well.
I would say this is an important time to have well-controlled asthma. This is also a good time to have well-controlled high blood pressure, well-controlled diabetes. This is an important time to take advantage of the fact that a lot of primary care offices are not overrun with business just now. This is a good time for you to make sure your medical vulnerabilities are attended to.
Absolutely.
And I guess one other thing I would add, just as if she's trying to do stuff at home, is a worry journal. If at times when she's feeling really worried or she's feeling very anxious, just writing down. It doesn't necessarily have to make complete sense, but getting those worries out of her mind or just like rolling around in her head can also help. It won't take them away completely, but doing kind of a journal exercise when those worries come up so that she can kind of reduce some of that rumination.
Thank you. And I'm going to try to get in one last question, really more of an observation. I want this individual certainly to reach out the same way the patient with asthma was recommended to reach out to JoJo. But this question is, I'm a lung cancer survivor of 18 years and recovering from COVID as well. I feel I had a mild case, some shortness of breath, but no pneumonia. I'm just very fatigued now, trying to donate plasma, but I have low iron. I worry more about everyone else. It has added more stress and makes it harder to manage. We seem to don't know what to do. It's hard to juggle everything. Any suggestions? And the one suggestion I would have is certainly reach out to the American Lung Association, our helpline, our website, and we can certainly help with that as well. And it sounds like you are dealing with a number of factors that we're designed to help deal with the same way NAMI helps with the mental health issues. The Lung Association can help you deal with the lung issues along with the emotions that are brought up by that. Any other comments on that?
I'm glad you had a mild case and that you're so thoughtful about other people. You may be a source of support to some people. The person before who has a lung vulnerability and is anxious, you are a person who's come through this. It doesn't mean everybody's story is the same, but people like to feel joined in anxiety. The old expression, pain shared is pain halved. Right? And this is why support groups are powerful. You don't need a social worker or a psychiatrist or psychologist to solve every problem. Support, the idea that we're in this together.
Right. So that brings us up to the hour. So I want to thank all our panelists today, all our participants today. It's been a great discussion. It's an important and critical conversation we've had. Please note the resource box on the screen does include some important resources that we discussed during the town hall meeting today. And as a follow-up to today's program, you will receive an audio recording link to the program and resources. And at this time, I want to invite you to our fall town hall series in September, which will be COVID-19 and vaccines, clinical trials, immunity, and immunization. And the phrase restrictions in place until we have a vaccine have become a common closing statement when announcing social distancing measures. We all collectively hope for the creation of a vaccine to prevent the further spread of COVID-19. So please join us with other top experts at our town hall meeting in September. And thank you for taking the time today.
Thank you.
Thank you, everyone.
Thank you.